Hey everybody, it's Dr. Missy. It's about 10:30 at night on day 21. As of yesterday, at about 8 p.m., I started feeling pretty bad. I got new symptoms that included shaking, chills I'd never had before, unbelievable watery diarrhea I'd never had before, a severe headache that I'd never had before, and I was pretty unsteady on my feet. My feet just didn't seem to work. I was kind of sidestepping everywhere I went. Really bizarre. My temperature currently is 98.1, which is normal. My pulse ox is 98%, which is normal. My pulse is 92 sitting down, which is a little high. I normally run 70. I was okay yesterday. My lungs filled up around 8 o'clock. At 8 and at 11 o'clock, Phil did the lung drainage drumming on me, the chest percussion with pulmonary drainage. And we got up volumes, which was a little scary because I've been on antibiotics for a couple of days because the first clinic told me I had a pneumonia, and I had done really well for 2 days, but kind of like this whole illness, after a couple of days of good, I get slammed with really bad. The new symptoms were scary. They concerned me. I felt like maybe I was developing an immune hyperactivity where the immune system overreacts, and sometimes your own immune system can kill you. We all know about how the immune system can hurt you. Rheumatoid arthritis is an immune disorder. Lupus is an immune disorder. There's so many immune disorders out there that you all know that are hurting people. But this thing is called a cytokine storm. It's kind of complicated. I don't really understand it that well either. But the cytokine storm is what they think is actually killing people in the end, along with the pulmonary problem and multi-organ failure. And anyway, I was concerned with the way I'd gotten really bad even on antibiotics. I was getting new pain not only on the front right side of my chest. When I would breathe in, I can't take a deep breath in anymore. I'm kind of limited on that. I was getting pain right kind of around my fifth rib on the back right side. I still have that. It's on the right side, which is where my chest x-ray today showed a new pneumonia, despite all this pulmonary toilet. So anyway, I went to the emergency room. I'm at Vanderbilt. I'm in Nashville. There's my Vanderbilt patient thing. On the way to Vanderbilt, of course it's freaky. This is worse than saying, hey, the baby's coming, and everyone freaks out and runs to get them to the car so mom can get to the delivery room. This is like, get mom to the hospital or she's going to die, or get mom to the hospital and she might die anyway. So anyway, it's pretty freaky for Phil and I. I had a pretty hard conversation here. We told each other how much we loved each other. On the way to the hospital, I called Joey, my son. Basically said goodbye to him. I called Erica, but I couldn't reach her by the time we got to the hospital. I called my mom and dad. I'm sorry. Try not to cry, but I can't help it. I said goodbye to them. I called my brother, but he didn't answer, so I couldn't say goodbye to him. Anyway, we got to the emergency room at Vanderbilt, and Phil jumped out of the car, and we said one last goodbye. Just because a lot of people, once they go in, nobody sees them, nobody hears from them, and the call they get is that they died. So I wanted to say a legitimate goodbye, and I told him how he was the best thing that has ever happened to me, and what a blessing he's been in my life, and that I loved him dearly. And then I'd see him as soon as I could, wherever that was, you know. Anyway, I went in and had to go through security. Had to get checked in by, a lady that gets your name and your birthday and things like that. And then she took me around to another separate area. Gosh, my neck is sore. Anyway, then the nurse came in. She was a really kind lady, and she agreed that my symptoms sounded very much like COVID-19, and that she was surprised I'd made it to 21 days. And then she started escorting me into the main corridor, which was really scary because about 20 times over and over again in walking a 50-yard corridor, there was glass panels on this side. There was about 100 providers, all decked out and everything. Behind glass to the left, a corridor I was walking through with her. I was the only one in the corridor with her. And then rooms on the right. And the only thing that kept coming over the loudspeaker was highly suspect B29. Highly suspect B29. Highly suspect B29. Anyway, towards the end of the hallway, over the door, I saw that it said B29. So apparently I was highly suspect. They had a bedside toilet in there. They wouldn't let me use a regular toilet even though I had horrible diarrhea, and I just wanted so bad to flush it, you know. They started an IV. They drew a bunch of different bloods. They did a chest x-ray and a 12-lead EKG. They wouldn't let me drink my Gatorade. Some of the labs that came back okay were ferritin came back as 2. Anything over 500, they're really worried about a cytokine storm, that deadly thing. And my white blood count came back 7.8, and anything really high, that there is normal. Anything really high, they're worried about a cytokine storm. So that was a huge relief to me that I didn't have a cytokine storm, even though my symptoms are changing pretty dramatically, and obviously fearing for my life at this point. The chest x-ray did show a new pneumonia in my right middle lobe, despite our very best efforts. I mean, Phil has just worked his ass off. My COVID test was done again. I did get the test back from 4 days ago. They said my COVID is negative, that I don't have it. But there's a True Science article out and many articles that show that the COVID test, swab test that they're using where they go really deep, which is the one I had 4 days ago and the one I had again today, they have about a 30% false negative report, which means 30% of the time they say that you don't have it, but it's false. So I haven't relied on that information and suddenly taken my mask off when I'm with people, or suddenly gone shopping or gone outside. We're still quarantined because I just can't think of anything else in the world that would do me this way for 21 days. Sorry. Except for that. So on a positive note, because this has been a dramatic video and I'm just not into drama, but this is real shit, and sometimes real shit's drama. Anyway, most patients, the doctor told me, he said, no, the pneumonias come in at 5 to 7 days. They're not seeing anybody after that. 5 to 7 days, COVID pneumonia comes in. I'm on day 21. He said it was really unusual, and that this is the first case that they've ever seen. He also agreed, the ER doc, that this is definitely COVID-19, even though the test is negative from the first test. That's why he did the second test. I should hear back on that in a few days. It might also come back negative, I don't know. He praised me that the pulmonary toilet was the only thing that has saved us. And I just thank Phil Chamberlain, because I think he's saved my life already before this, but particularly now. So I'm going to get pulmonary toilet now and go to bed. And I think we're going to record Phil's story tomorrow about the percussions. Just how kind of scary that is when your loved one's kind of choking on their own phlegm, and you don't really know how to help them. And then also the story about today, because that was as real as it gets, folks. Anyway, thank you for your love, and I'll see you tomorrow.